So at Nuviva, they offer a bunch of different medications to help support people with their weight loss programs. Can we just run through a couple of the pros and cons for the different ones so people can get a better understanding of them? Let's start off with phentermine.
Yeah, so Phentermine.
Sorry, bad accent.
Phentermine. So Phentermine's an FDA-approved appetite suppressant. So, obviously appetite control is really important when someone's trying to do a calorie-restricted or a particular food-restricted style of diet. So taking something that helps you not want to eat. One of the other advantages that a drug like phentermine provides is that it has a stimulant effect to it. So it makes you feel alert and awake, giving you energy to like get out there and do stuff. And so a lot of people really like phentermine or that class of medications, not just because it helps them eat less, but it also helps them want to do more. And so if you're wanting to do more and wanting to be more active, then it helps you, burn more calories and get yourself more motivated to get out there and exercise or go to the gym. And of course, that kind of helps to translate into a stronger calorie burn throughout the day.
And for people that want to know the full scope of what they are putting into their body, what are some of the perceived cons that would maybe deter some people from using this?
First off, because of it being a stimulant, it does have some anxiety, increased pulse rate. Some people will report that it increases blood pressure. If they have cardiovascular disease or any cardiovascular histories, they should be cautious of using this medication. So, of course, the pre-screening of the EKG and the blood test and the doctor's consultation is really important before considering using this. You will build up a tolerance to it, so it needs to be utilized for the correct duration of time, and to a point you don't want to use it for too long of a period of time due to the possible side effects that it can cause. We offer it in a few different strengths, so we have weaker versions and we have stronger versions. Obviously, the stronger versions are for somebody who's built up a tolerance to the weaker ones. It tends to make people feel a little cotton mouth or a little bit more like dry in their mouth, so they really get real thirsty, which, I feel like is to some point a little bit of a benefit in our program because it helps you want to get in the pattern of drinking more water, and water is really crucial when really following a strict diet. So one of the cons is the potential increase in blood pressure and anxiety and jitteriness. The second is inability to sleep. So if you take this medication too late into the afternoon and it's still effective into the evening time, you're going to lay down and still have the stimulant effect that's going to prevent you from sleeping. So that may not be too beneficial in your diet program. And probably the biggest downfall to this stuff is that when it wears off, the effects wear off. And so if you take it early in the morning and it suppresses your appetite all day and it gives you the energy all day, and now the evening time comes around where most people have a hard time dieting to begin with, all of a sudden their appetite comes back and their energy drops. And so now you find yourself wanting to eat in the evenings and wanting to be kind of like lazy and not have energy because the medication that was supporting that appetite control and giving you that energy is now not there. So phentermine has its place. We use it in our program to help people stick to the diet. But when a person who is using this is not eating enough or doesn't have the appetite to even eat as frequent as we hope them to, which is hard to kind of understand when you don't understand the potential problems that most people have coming in here, which is most people don't eat enough. They actually don't eat breakfast and they don't eat lunches and they eat these really large dinners, which is a problem. If phentermine is making it so they have even a harder time eating breakfast and even a harder time to eat lunch, then obviously this medication shouldn't be used. It's great for those who have a really big appetite, who have really hard cravings, to stick to the diet that's outlined to them, and also those clients have a hard time really getting themselves motivated to do something. So we use it to kind of launch them off into that diet program and hope that they don't have a dependency and a need for it to keep up with the diet after.
And then the next one, which is obviously taking the whole of America and I think the world by storm. Everyone's focusing on it. Everyone's excited about it. Semaglutide. What are the pros for this to start off with?
Yeah, semaglutide is an amazing medication. It's been recently introduced about 2 years ago, at least our practice. We've had tremendous success with offering it. It trades under the names like Ozempic and Wegovy. The drug name for it is semaglutide. Basically, semaglutide has 3 benefits when using it for the purpose of weight loss. The first of which is that it tricks your brain into thinking you're full. It actually creates this lack of appetite for an extended period of time because the drug is used once a week. So it's a little injection you take into your belly fat, and through the duration of the week, between shot and shot, you will have basically a limited appetite during that entire time. You'll feel as if food isn't really that important to you. And when you do want to eat, really nothing sounds that appetizing. So that obviously makes dieting very easy because instead of living to eat, you eat to live. So you'll be able to stick to the diet that we outline extremely easy. The second is that it actually slows down the speed that your body digests food and empties the food from your stomach into your GI tract, called gastric emptying. Now, that process is why you will find yourself hungry after you eat a meal and typically want to have the next meal, or during the duration of the one meal, find yourself still being not full yet because that food has kind of been digested and all of it worked its way through. So if you've ever eaten a lunch, and at the end of the lunch, you're like, I'm still hungry. Well, the reason you're still hungry is because that food that you ate wasn't by volume enough. So this medication can slow down the speed that your body broke that food down and allow it to feel like a whole lot more. So not only do you get full a whole lot faster, but you stay full a whole lot longer. So if you ate lunch at 1 o'clock and you're typically looking for a snack at 3, that 1 o'clock lunch, which number one, you probably didn't want to eat to begin with because you didn't have much of an appetite. But number two, you probably ate half as much as you're used to because your body slowed down the speed of its digestion. By the time that snack time comes around, you're not going to want it because that food's still lingering in your stomach and kind of creating this sense of fullness as well. So not only does your brain think you're full, physically your stomach still feels full too. So that's a really great way to avoid overeating or having frequency of foods that kind of create the inability to lose weight or the process of gaining weight. And then the third thing is that it regulates your blood sugar. So by regulation of your blood sugar, it actually limits your desire to have foods that influence your blood sugar, things like sugars and starchy carbohydrates or even alcohol. So you find yourself not wanting these particular food choices because your cravings are very much controlled. So it has 3 really great attributes to weight loss: not being hungry, staying full quicker and longer, and not having cravings for food choices. So those are the 3 trifecta to why semaglutide is such a great medication.
And what are some of the cons that people may or may not want to be aware of?
Well, the number one biggest complaint is nausea. So people will take this and feel a sense of sickness to their stomach, which can be to some point tolerable because it's part of that not wanting food and kind of not having an appetite. It can be manageable by utilizing B12 injections and B6 injections, which is in a product that we offer at our office. It tends to limit the nausea because it has a natural anti-nausea property to it. So that kind of sick to your stomach, nauseous feeling is number one. Number two, some people can get GI tract problems like constipation or diarrhea. Either end of the spectrum. Either makes you go to the bathroom more or makes you go to the bathroom less. Some people will get a lot of diarrhea from it, and some people will get really bad constipation. So making sure you stay up on your fiber intake, making sure you eat good quality food choices that are not overly greasy or have high quantity of fiber in them, staying hydrated, they'll keep your GI tract moving and keeping it healthy. Third kind of category of problems that we see is acid reflux, heartburn problems. I, for one, have both acid reflux and heartburn. And so when I use semaglutide, it really does make it worse. And part of that is because, especially if you eat in the evening time, when you lay down and, you kind of lay down on your side, your stomach still has food in it, you kind of get that reflux. And obviously having eaten too close to bed is a problem, or certain types of foods are a problem. So you start to live and learn on what you shouldn't eat. Those are things that help dieting be easier. Number one, the foods you tend to love cause a little physical discomfort, but secondly, avoiding eating too close to bed, because again, that will disrupt your sleep and give you some agony and that acid reflux issues that you're dealing with. And so those are like your 3 top tier side effects. Now, more severe things can happen. And obviously if bigger problems present themselves, we tend to tell people let us know, or, even worse. But some people also deal with some energy deficiency problems, kind of feeling exhausted and tired. And that's with the blood sugar regulation, you tend to find yourself with a little bit of energy lull when at least getting kind of used to this, used to the product.
And what about with I mean, we're hearing things about Ozempic Face and those other things that, from my understanding, and you can correct me, it's largely because of a misuse or mismanagement of semaglutide.
I mean, look, this medication would make it very easy for you to simply not eat and starve yourself. And if you know anything about dieting, it's not about how much weight you want to lose in a short duration of time. It's about losing fat during the process you do it. If you're just taking this medication to a degree where you absolutely don't eat, or you don't eat any type of adequate amount of nutrition, you're going to lose muscle mass, you're going to lose structural fat, you're going to lose body fat, you're going to lose a little bit of everything. And that isn't exactly what you're looking for. Most people come to a program like ours or enter into any weight loss program with the concept of wanting to lose fat, wanting to lose their belly, wanting to tone up, and they don't think about the consequence of losing the good parts of their system, their muscle mass or their structural fat that give them that youthful, like healthy appearance. So taking it in combination with someone who knows how to steer them in the right type of dietary direction can end up in the right place with the right type of look, where they look healthy, they feel healthy, have supported muscle tissue, and end up leaner, not just skinnier.
So someone who wants to make sure that they are using semaglutide in the correct manner, who is it that they should speak to? Is it like the coaches at Nuviva? Obviously, they're going to be well experienced with it. Do they manipulate the dosages based on what's required for somebody? Or is this like typically just a one size fits all situation?
Yeah, this medication is 100% not one size fits all. Every person who goes through the use of it will have a different, well, it's every certain person, but like there'll be different people going through different processes of the dosing schedule. So everybody starts at the same entry point, but how and quickly they go to the next dose, the next strength is definitely up to the individual and how much their sensitivity is or how much their resistancy is. And so working with somebody who understands that can help them have a really enjoyable and a low side effect process through it. We can't guarantee we're going to avoid all your side effects, but doing this on your own versus doing it through the skilled hands of a clinic like ours, you're going to have a different experience. And then we can also tailor that to a dietary program that's going to afford you the outcome that you're looking for, which is not just overall weight on the scale, but focusing primarily on fat loss and making sure you have a healthy, muscle mass when this is all said and done, so your metabolism works really, really well with you.
What type of peptides assist with weight loss, and why do they?
I mean, so peptides is a new frontier in medicine over the past few years, and we've introduced them many years ago, actually. We've had peptides available through Nuviva for going on 10 plus years now. A lot of places really started using them relatively recently, and I feel a lot of practices, unfortunately, don't have a lot of knowledge in it. But peptides are a way to turn the program of your body to do something more optimal. And in some cases, that would be for your body to figure out that growth hormone production should be increased. So human growth hormone, which is one of the best hormones in fighting fat and maintaining lean muscle mass and improving sleep quality as we get older, starts to kind of come in shorter supply. So taking a peptide can ask your body to produce more of that hormone that all of a sudden turns on the metabolic switch that says, hey, burn up fat, and hey, lean up, keep muscle mass and sleep better at nighttime. So if we combine that with these calorie restricted diets where most people would not lose weight as fast, or they would lose more fat than muscle, if you combine that diet program with the peptide, not only will you see a more faster and a more effective result, but the end result will be what you were looking for, which is a leaner physique, a more healthy looking profile, body composition profile. You'll feel better through the process. So, we work with a particular peptide blend that really optimizes the body's growth hormone production. We also work with a different peptide that helps the body to figure out to use body fat over muscle mass in a dieting environment. So if you're dieting, the typical what's going to happen is the body will burn up muscle mass as opposed to fat, because that tends to be the survivalship of the body, right? So if I'm in a calorie restricted state, my body would tend to want to burn my muscle before my fat, because the body can burn fat at 9 calories per gram, but it burns protein or muscle at 4 calories per gram. So it requires a lot less effort, less calories to burn protein or muscle, and a lot more effort and energy to burn fat. right?
Yeah.
So if my body's programmed to go after, muscle mass instead of fat, and I go into a calorie restricted state, I'm going to give up muscle first. That's just the nature of the beast. But if I'm taking a peptide that helps my body kind of reprogram itself and say, hey, leave that muscle behind and go after that fat, that's a pretty great way to alter the physiological way we're programmed and say, go after fat and leave behind that muscle. So in the end, you end up losing body fat instead of muscle mass. So peptides can really lend themselves quite well to a really great dietary plan that's already established. And sometimes these things can be combined. So we'll have people and clients that will combine a semaglutide with phentermine with a peptide all together for a really great kind of robust program.
And the final one that I've got is the healing peptides. Obviously, our body's ability to repair itself is also what's going to help it process body fat and get rid of all the toxins and everything that does inhibit our fat loss.
Yeah. So
what's the peptide that we use, or what peptides do we use for assisting with the healing of the body?
So there's a peptide called BPC 157, and it's not right for everybody to use during our program. So it's actually an add-on kind of product that we offer here at Nuviva. But if you have a lot of gut issues, leaky gut problems, diverticulitis issues, Crohn's disease, issues in the gut that find themselves plaguing you and making your dieting process difficult, healing the gut and allowing yourself to have a healthy dietary environment where you don't have inflammatory problems or issues with particular type of food, this particular peptide can make the process of dieting so much more easy, so much more comfortable, and a whole lot more effective. So I personally have diverticulitis. I use BPC 157. It makes me be able to tolerate the foods that I love to eat without the inflammatory problems. And I get the weight loss results from those foods that I used to not be able to eat because I'm taking that particular peptide.